My name is Tamy Bui, and I'm a public health student at San Jose State University. I believe that everyone should have an equal chance at living a happy, healthy, and fulfilling life. And this is why I support the movement for single-payer universal healthcare. I grew up in a low socioeconomic status household myself, and I've seen firsthand how not only one person's life, but a whole community of people's lives can be affected by factors that are out of their control, such as their race and where they live. In one of my classes this semester, we also discussed the difference between a personal problem and a social problem. A personal problem is an issue that affects only an individual, whereas a social problem is something that affects many people. While learning about this, I discovered that a lot of college students are either skipping or delaying healthcare services due to cost, or someone in the family is. And this is true for many people across the country, not just college students. For me, my brother suffers from severe asthma, which he developed when we were living in low-income housing that was situated right next to Highway 87, which has a lot of traffic. We lived there for 21 years, despite knowing that the pollution from the freeway was affecting his health because we didn't have the resources to move anywhere else. The cost of treatment for asthma is very expensive, even with insurance, and my brother has skipped taking his medication on multiple occasions due to issues of affordability. It's difficult for my parents and I to see him struggling to breathe when he shouldn't be. When I was discussing this personal problem with my classmates, they shared with me similar problems that they were having. My classmate's father has cancer, and the cost of treatment is so expensive that they don't know how they'll be able to afford it. My other classmate hasn't been to his primary care doctor in over 3 years due to cost. In public health, we learned that skipping or delaying health services ultimately leads to worse health outcomes later on in life, and even in some cases, premature death. Now, the fact of the matter is not that people should work harder to be able to pay for health services or that they should make better lifestyle choices to better their health. Many people in our country can't afford to do these things, even if they work really hard all of their life, because historically, US institutions are not set up to help racial and ethnic minorities. No one should have to skip their medication or their doctor's appointments or their necessary treatments just because they can't afford it. If people in other countries have universal healthcare, why can't we? The single-payer healthcare system is one that can help reduce many health disparities that exist within our country. Everyone deserves a fair chance in attaining good health. That's why I'm in the fight for single-payer healthcare. Thank you.